Welcome back to Girl Talk. We are here at the Beaufort Memorial Hospital Bluffton facility in Westbury Park, and I am joined by the newest orthopedic specialist, Dr. Vandit Sardana. Thank you so much for being with us.
Thank you.
You've only been here a couple of months.
Yes.
So welcome to the area. What brought you to Beaufort Memorial?
So I just finished my fellowship training in New York City, and I was looking for a job. My wife and I are from a small town in Canada. We're looking to move south a little bit to warm weather. And when Beaufort Memorial approached me with the job, they were looking for a fellowship trained joint replacement surgeon. They didn't have one, so that was our calling. We had been here in the area before, been driven by the area. We had stayed in Hilton Head for vacation, and that's it. We jumped on it, and we're blessed to be here, and we're here.
Yeah, good for you. Well, welcome. We all love living here, so we're happy to have you here. And you have joined Dr. Kevin Jones's team, and he's kind of famous, if you will, in this region as being one of the specialists. So tell us why you wanted to join his team.
So Dr. Jones has established himself as a joint replacement surgeon, and me coming with a fellowship experience from New York City, having been worked with the pioneers of knee replacement, I think that was a great opportunity to join in and serve the community and provide that same level of care and take it to the next level even.
Right, and let's talk about that next level, because being fellowship trained, that's a little bit different. Tell us what that means and what you got to do as a fellowship trained doctor.
So fellowship training is for the subspecialization in orthopedics. It's an optional training. People do fellowship training in different things like sports, pediatrics, traumatology, oncology, and joint reconstruction. That's what I did. So you work with a surgeon, you do your surgical cases, you get a regular feedback on little tips and techniques of what you can improve in your surgery. And I was privileged to be working with some of the pioneers of knee replacement in New York City. And I learned a lot from them. I did about over 500 cases there, all complex revisions, complex primary joints, or bread and butter joints too. And the feedback I got from them is helped me build up my little tips and techniques, which I use and help make a successful joint. And the reason I did a fellowship training was because I wanted to provide my patients the best quality of care I could. Yeah.
And so you said bread and butter joints. Am I guessing that's maybe like knees, hips,
knees and hips,
things like that?
Knees and hip replacements that don't require any special. They are simple and straightforward to do. Don't have any complex issues with them. But there's always a technique to balance the knees well and balance the hips out well.
Well, let's talk a little bit about that. What questions do you get the most? What kinds of things do people come to see you for the most?
So I see all kinds of people for knee and hip osteoarthritis mostly, because I find there's a lot of population that's suffering from osteoarthritis, and that's my major practice.
And do you find that you see more women with that, more men with that? Does it present differently in women and men?
It does actually. If I look at it in terms of knee osteoarthritis, we see that it's more common in women compared to men.
Really?
And yeah, the symptoms they present with are a little bit more disabling. So they have functional disability, more pain, severe arthritis in them. And I think the reason goes down to because there's differences in anatomy. If you look at real down bone anatomy, there's different shapes and sizes of the bones. There's different in kinematics of the joint. Even the hormone itself, like being postmenopausal women with lower estrogen levels, predisposes into higher osteoarthritis risks. And then I also see that previous injuries cause accelerated osteoarthritis. And if you look at women, especially in the knees, their ACL ligamentous anatomy is different, and they're prone to injuries as early in life, being an athletic female. And which, again, we know by literature that if you have an ACL injury, you're going to be predisposed to osteoarthritis.
Interesting. I did not know that. So does that mean that people should be less active?
No, absolutely not. I recommend to all my patients to be active and maintain that active lifestyle. The active lifestyle not only gives you good quality of life, but maintains your joints in good muscle strength, good flexibility, which in turn takes off the load of the joints. And having a sedentary lifestyle leads to unnecessary weight gain, which is again a stressor on the joint.
Well, and adds complications to all kinds of different things. I mean, it makes the stress on the joint, but it makes treatment options different.
Absolutely.
Too. So, and how do you treat osteoarthritis?
So osteoarthritis recommendations usually by the academy are non-operative management first, which includes activity modifications, and then onto the surgical options. In my practice, my first line of treatment is non-operative treatment, which includes exercises, bracing, injections like cortisone injections, non-steroidal anti-inflammatory medications, viscosupplements like hyaluronic acid injections, regenerative medicine, like stem cells. Further on, like complementary medicine and alternate medicine, they all add in and help. But once all these options are exhausted, the only option left behind is a surgical option.
I think that's kind of interesting, though, that there are so many non-surgical. I mean, I had no idea that all of those things you just ran through are things that you can do to try and avoid surgery. And does that translate into like another area, maybe like the hip too as well?
Yes, absolutely. So the same treatment options exist for both knee and hip in terms of start off with the non-operative and exactly the same multimodal approach and then move on to the surgical option if they all fail.
Okay, because I think maybe people would be a little bit, I don't know, maybe I would be, I'm not a big person who's like, hey, let's have surgery. So I would think maybe I'd be a little wary to go in because I would think maybe that would be my first option. So it's kind of exciting to find out that there are all these other treatment options. And you've said even since you've been here just a few months, you haven't even gone into surgery with anybody yet.
No, because my approach is try the non-operative management. So
yeah.
I give at least 3 to 6 months for a patient to see how they do with all the non-operative treatment modalities. Once I've exhausted them, then I know we regroup and we make a plan for a surgical option.
So if somebody does need surgery though, what are your approaches to that?
So for knee replacement surgery, I offer minimally invasive surgery, which is computer assisted. The implant design I use comes in about 22 different shapes and sizes.
Wow.
So I match the shape and size of the anatomy, get them perfect anatomy back, normal joint kinematics, and balance the knee well. And I stress balancing the knee. Like an unbalanced knee is just like a car that's out of alignment.
Okay.
It leads to early failure as early as 5 years, whereas the regular longevity is about 20 to 25 years. So well-balanced knee with well-matched shape and sizes is a successful outcome.
That's really interesting. And so what about the hip?
The hip, I also try to match the anatomical alignment. I try to match the anatomy and get the proper kinematics back. There are various approaches to the hip out there, so people ask me a lot about the approaches to the hip. And they are the posterior approach, the anterolateral approach, the direct superior approach, and the direct anterior approach. I decide all the approaches based on the patient's anatomy, their disease process, and where the body habitus is and what allows me to get in there. But if I was to have a go-to approach, my approach is direct anterior approach.
Okay.
That's a minimally invasive surgery with muscle sparing that helps people get back on early, and we are even seeing same-day discharges. No hip precautions.
Excellent. Well, thank you so much for being here to share your expertise with us, and welcome to the area.
Thank you.
We wish you much success, and thank you for being with us, and we'll see you next time on Girl Talk.
Meet Dr. Sardana and his colleague, Dr. Kevin Jones, at a free Talk with the Docs Thursday, November 8th at 5:30 p.m. in Sun City. Call 843-522-5585 or visit BeaufortMemorial.org/seminar for information or to register.